everybody. Welcome to Jamestown Jobs. I'm Emily Bivens with the Jamestown Area Chamber of Commerce, and we're here today at Dr. Don's Pet Stop to see what it's like to be a vet tech. Let's go. Hi, I'm Emily with the Chamber.
Hi, Emily. I'm Chloe, and today we're going to learn how to do a urinary analysis.
All right, let's go.
Sometimes it's easier to use a flat one versus, a cup one.
What are these for?
These are for catching urine.
Okay.
And so you're going to follow really close behind, and the owner has them on a short leash. Usually you kind of want to squat down, and then you kind of just go in for the kill,
Okay.
So I'll give you one of those, and we can head outside.
These would have longer handles.
Right.
Do you guys just do this for fun, or is this an actual?
No, so we test the urine. Sometimes, they're like having accidents in the house, or, they could just be like, there's a little bit of blood you notice in the urine and stuff like that. So, we like to test that and see is there a UTI going on, or is it like a sterile cystitis, something like that. So
sure. Like what leg do you usually lift, Rooster?
You'll maybe go right between their legs, or sometimes you'll go on the side. Once he starts squatting, then you'll know. So you want to get pretty close to him.
I feel like I'm stalking him.
There you go. He's going.
Oh, where? I can't even see So, Chloe, what would prompt you to collect a sample like that? You have a patient that comes in. Do you do that for all of them, or what?
No. So if they were having like accidents in the house, or if they seem like they're dribbling around the house, or they're going outside the litter box. Those are signs, like they could be a little bit more painful.
Sure.
Like cats, for example, they go on.
I noticed my pet had blood in their urine or something like that.
So that'd be a reason I would test.
Okay. Yeah. Okay. And then you bring the samples back here. Mm-hmm. This is the lab.
Yes, we'd bring it back here. We would put it in the centrifuge.
Okay.
We would spin that down for 2 minutes, and then once that is all done, we take the sediment from the bottom of the tube, and you put that on a slide, and then it goes in this little machine here, and we just run the test, and it tells us like this is a urine test, for example. So like it tells you how many struvite crystals, how many epithelial cells, bacteria, and then it also does reds and white blood cells.
Okay. So if any of those are abnormal, then you kind of know
what we got going on there.
What you got going on. Cool. Yeah. All right, now we're here with Kayla. She's another vet tech here at Dr. Don's. Hi. And what are we gonna do now?
So
I think I've done it all. I've already collected the urine and the poop. Now what do I do?
So I'm gonna take you into an exam room, and we're gonna teach you how to clean some nasty ears.
All right, let's go. So this is Acacia, this is the patient. She's a poodle, she's a service dog. She's got a cute little pony. When would you clean a patient's ears? What would prompt you to do that?
If they had a really bad ear infection, sometimes if like a cat were to have ear mites and we wanna clean the ears really good, get in there, and then after that we're gonna do treatments. So some type of drops that they could put in, might have to take home drops, do them at home. We do treatments here at the clinic, and then come back for second rounds of that as well.
How would you know if they have an ear infection?
So a lot of times, there's gonna be a lot of brown gunk in there, sometimes some green discharge. If it's super red
hers are just dirty. She doesn't, because I see hers aren't red or swollen.
But if it was like super red and inflamed, sometimes it can be a little bloody in there. You're gonna call that an ear infection.
So I have a chocolate lab at home, and so she was a bird dog. She got in the water, so whenever she gets in water, it's like her ear swells up a little.
Yes.
So I do have a little bit of experience with ears and dogs. But your ears are pretty dirty there, Acacia.
So I'm gonna flip that ear open, take my cotton ball, kind of shove it down in the ear there, and then I grab the base of the ear and just kind of
mush it together.
mush it together.
That looks kind of painful, but it's not.
So if their ear is super inflamed, it definitely can be pretty painful for them. So we have to be a little bit more gentle at that point. But doesn't have any sort of infection, so she's not feeling any pain.
Look
and
at all
we do
those
this.
potatoes in your ear. She's like, what is going on?
And then we just continue to do that until it comes out clean.
Ooh, that was a good one.
And then in the end, when we were all done, we would normally do a dry cotton ball, soak up any of the moisture, and then we would do treatment, whether it's drops or...
Sure. Okay. Kayla, how long have you been here at Dr. Don's?
So in September this year, I'll be here for 3 years.
3 years. What's your favorite part about working here?
Honestly, probably, I don't know, I like to do lab work, so like blood draws, things like that, running labs. That's probably my favorite.
Okay.
Or surgery. Surgery is pretty fun. All the techs here help like monitor the surgery, so monitor like heart rate, breathing, all of that throughout the surgery while Dr. Don performs them. And then we just watch our patients after for recovery and everything. So everybody here works as a team to do that. So that's one thing too about working here. Everybody's helping everyone out, so it makes for a good team. Yeah.
Hey, I'm Morgan. You ready to learn how to do a fecal today?
Yes, let's
Okay.
go.
So first I'll have you put these gloves on because nobody wants to touch this stuff usually.
Very true. Probably should have wore gloves when we gathered this, but you know. You guys like to live dangerously.
We're testing to see if there's any parasites, worms, protozoans, or if there's just bacteria going on.
So kind of the same type with the urine. If a patient comes in, they're
so
having
diarrhea,
accidents. Sure.
Hard stool too sometimes because a lot of older cats have hard stools.
Sure.
So
they haven't gone in a while, I suppose.
Yes.
Okay. I wish you guys could smell this. It's very, very good.
So now that we would have it sit there for 10 minutes typically, because then we know all the fecal eggs, bacteria, protozoans, whatever could be in the poop would float up to the top and stick to the cover slip.
Oh.
So we would grab our cover slip and just slap it on our slide. And what we would normally do is take the slide and go to the microscope and look at it.
So, how many different types of animals or what kinds of animals do you guys all see?
We do mostly do dogs and cats, but we have seen snakes, mice, rats, snakes. I have a tortoise actually, so we do tortoises, we do cattle, goats. If they can walk in, we see them. Otherwise, typically horses, they have to be trailered in and we go out to the back.
Sure.
Otherwise, Dr. Don goes to a dairy every Thursday to do preg checks and blood draws. But
Okay. So what about birds? Do you guys?
oh yeah, we do birds. We basically do anything that can fit in this building.
Okay.
As long as the owners know that we're not specialized in it, then because we're specialized more in cats and dogs and
Sure.
more family-friendly animals
Yep.
compared to others.
Yep.
But
Well, thanks for showing me around and having me do a few things. So say I'm ready. I want to become a vet tech here at Dr. Don's. What do I have to do? What do I need to have? How do I apply?
so we do on-the-job training here. So a lot of us here are actually not vet techs, we're vet assistants.
Okay.
We only have a few vet techs here. So we can train you, or you can be a vet tech, or you can be even a licensed veterinary technician. So whatever works for you, but we teach everybody everything because at each clinic it's just a little bit different.
Sure. Sure. And then how do I apply?
You would just either drop off an application here, email an application or resume, I should say, in here, or you can even mail one in here.
Okay.
So,
and how many are you looking to hire? How many techs or assistants?
one more full-time veterinary assistant or tech, whatever you are, we'll take you.
Okay. And the hours? What kind of hours do
We
you guys?
open at 8. A lot of us get here at 7:40, and then we're here until 5 is when we close. But a lot of times we stay after hours to take care of patients, or we have emergency surgeries.
Sure.
So,
Are you guys on call too on weekends sometimes, or?
sometimes we are. There's a few clients that do have our Facebook accounts for either Dr. Don or us techs, and they reach out to us at odd hours. And sometimes we go to people's houses at 2 o'clock in the morning. But it's all fun because we do it for the animals'
Absolutely.
sake. So
Absolutely. Very cool. Awesome.
thank you.